One of the things that really distinguishes compassion-focused therapy is that compassion isn't just a feeling or a nice idea. It's a motivation and skillful action, and something we can actively train and embody. One of the most central practices in CFT is what we call the compassionate self. This is something we'll be introducing and working with in depth across the 3-day workshop, because once people can access this, it becomes a foundation they can return to again and again. James is going to walk us through what the compassionate self is, how it's developed, and why it's so important.
Yes, so one of the key fundamental practices within compassion-focused therapy is called the compassionate self. And this is something we'll be introducing to people in the 3-day workshop. So the compassionate self has many qualities to it. There are many unique qualities that you can bring to your compassionate self. But within CFT, there are 3 big ones we focus on, and they are wisdom, strength and courage, as well as this caring commitment to try to work with your suffering and try to find ways to help alleviate it. And we'll take you through how to develop that compassionate self step by step. And then as we start to embody the compassionate self and get a greater feel for it, we can start to use that to work with some of the difficulties that we're facing. Difficulties with emotions, situations, relationships. The compassionate self really is a fundamental piece to trying to develop and extend the way we connect with the world around us, as well as ourselves, of course.
One of the things I really appreciate about this practice is that it gives people something to stand in. We're not trying to get rid of difficult thoughts or feelings. Instead, we're helping people have the compassionate self alongside them when those experiences show up. When working clinically with CFT, we often frame the wisdom aspect with a simple phrase: "It's not my fault, but it is my responsibility." That helps people step out of blame and shame while staying engaged and accountable in a compassionate way.
Interestingly, we've also in the research just looked at isolating that compassionate self practice by itself, just as a 15-minute practice. And we've found just doing even just that compassionate self practice can significantly improve your body's physiology in terms of increasing the parasympathetic system as measured by heart rate variability. So that's great work we've done with Dr. Jeffrey Kim and also Dr. Chase Sherwell. And at the same time, we've also found that embodying that can also help in tricky situations. So some parents mention, when I'm at my compassionate self, I'm able to better manage situations where my children are having difficulties, say at school plays or out at the shops or whatever it might be. And it helps them to remain present and grounded so they can respond to what's going on with their children in more compassionate, caring, helpful ways, as opposed to losing it and getting frustrated. We found the same also in some work we did with individuals who were experiencing body weight shame, that work we did with Dr. Alicia Carter.
That grounded presence is such an important point. The strength aspect of the compassionate self isn't about forcing yourself to cope. It's about cultivating steadiness. I often quote the wonderful Dr. Deborah Lee, "A calm mind thinks differently." When people feel calm and safe, they have access to different choices, different ways of responding, especially in moments that would usually tip them into shame, anger, or avoidance.
So yes, the compassionate self, really important, and we'll be diving deep into how to develop that and begin to use it. We say put it to work with the difficulties and the challenges that people often are experiencing and they come to therapy for. So yes, Dan, what do you make of that?
Yes, I'd absolutely agree. For me, the compassionate self becomes something people can bring with them into difficult moments, rather than something they try to achieve or perfect. Sometimes I'll invite clients to imagine the compassionate self sitting beside them, not fixing, not judging, not arguing, just present. And from there we ask, how might I respond from wisdom? How might I respond from strength? And how might I respond with care and commitment? Often we come back to that caring intention. May I be helpful rather than harmful towards myself and others. That alone can completely shift how someone meets a difficult experience. So yes, this isn't just a practice we talk about, it's something we actively train, embody, and use. And that's exactly what we'll be helping people to do in the workshop.